Analgesics, sedatives, and hypnotics. Analgesics relieve pain, sedatives calm, soothe, and produce sedation. Hypnotics produce sleep. It is important to remember that pain is subjective and each patient has a different level of pain that is perceived. Analgesics come in three categories: opioids, which is all controlled substances; non-opioids; adjuvants, which enhance the analgesic effect of opioids and non-opioids. They produce an analgesic effect alone or reduce side effects of analgesics. Opioid analgesics are codeine, fentanyl, which comes in a patch, hydrocodone acetaminophen, also called Vicodin, hydromorphone, also called Doluid, meperidine, also called Demerol, methadone, morphine, also called MS-Contin. This is often prescribed for cancer patients for their pain. Oxycodone, also called Oxycontin or Percocet, and tramadol, also called Urtram. Drug abuse. Addiction is a psychological dependence. There are several different types of treatment. The first is Narcan, which is used as a narcotic antagonist, is used for overdose. It reverses the effect of the narcotic medication. Revia is used for alcohol abuse and opioid dependence and comes in an oral medication. Also comes in an implant called the naltrexone implant. This is used to increase the compliance. The implant is inserted into the lower abdomen and lasts 3 to 6 months. However, some insurance companies consider this investigational or experimental and will not cover it. Suboxone is mainly used for opioid dependence, and only certain providers in Wisconsin can prescribe this medication, so it is important that you know if your provider is a Suboxone eligible provider, eligible to write out those prescriptions. I believe Marshfield Clinic has 2 and Aspirus has 1 or 2 physicians that can write out the Suboxone prescriptions. Methadone is used to treat drug dependence such as heroin. Methadone is an opioid, but it decreases the withdrawal. However, it can be very addictive too, so there's kind of a fine line as to how much and how long this medication should be prescribed to avoid the addictive phases of methadone. Naloxone or Narcan, like I said, is a narcotic antagonist. The side effects, you return to the symptoms prior to taking the narcotic. There's usually an increase in blood pressure, tremors, and hyperventilation. Non-opioid analgesics typically treat mild to moderate pain. Some of the medications in this class are aspirin or Ecotrin, acetaminophen or Tylenol. There's combinations: Anacin, which has aspirin and caffeine; Excedrin, which has aspirin, acetaminophen, and caffeine, often used to treat migraines; and salicylates and NSAIDs. All of these are available over the counter. It's important to note that Tylenol mainly treats pain, ibuprofen mainly treats inflammation, and aspirin is an antipyretic, which is usually used to treat fever, however can be used to treat pain and inflammation. Patients need to watch so they don't overdose. Also, if you have too much, it can take effect on your kidneys and liver. And it is recommended that these medications not be taken, especially ibuprofen and Tylenol, should not be taken longer than 2 weeks, mainly due to the effects that it can have on the kidneys and liver. Aspirin is oftentimes associated with stomach ulcers and bleeding, so it's important for patients to remember to watch for occult blood in the stools, stomach irritation, gastric reflux, those sorts of things with taking aspirin for long periods of time. Adjuvant analgesics may enhance the effect of the analgesic effect of the opioid and non-opioids. They may reduce the side effects of analgesics. There's 3 different categories. There's tricyclic antidepressants, oftentimes amitriptyline is prescribed, SNRIs, Cymbalta or Effexor, and then an anticonvulsants, Neurontin is the most common, Tegretol, and then there's also Lyrica that are prescribed. Lyrica and Neurontin are very common for neurotic type pain, diabetic neuropathies, any type of sciatica, those sorts of things. Neurontin and Lyrica can be prescribed. Local anesthetics. Lidocaine patches, or Lidoderm it's also called, works by causing a temporary loss of feeling in the area applied. Treatments for neuropathic pain, this can be for herpetic pain, diabetic neuropathies, those types of things. Sometimes it can be prescribed for back pain, but insurance companies don't like to cover or pay for those prescriptions for that diagnosis. It is important to apply to intact skin. You need to tell patients generally they wear the patch for 12 hours and then they take it off for 12 hours and they rotate that 12 hours on and 12 hours off. It is important to avoid getting wet or to wash your hands after application. Antimigraine drugs. Use prophylactic management of migraine headaches. Most common medications are the Maxalt or the Imitrex, also called sumatriptan. Sedatives and hypnotics, there's 2 major categories, the benzos, which temazepam or Restoril falls under that category, and then the non-benzodiazepines, Lunesta and Zolpidem or Ambien. Zolpidem is the most commonly taken medication for sleep. It is important to take on an empty stomach right before bed. And these medications should not be taken every day beyond 2 weeks due to the increase in dependence. These medications are controlled substances, so there are restrictions on medications, prescriptions. Healthcare workers' responsibility is important to educate our patients on narcotic use and dependence and tolerance. It's important to know our resources. There are resources out there now as healthcare workers where we can see when we're giving out those prescriptions, when the patient is filling them, and then if they are not, if the medication is not showing up on a urine drug sample, we can suspend their prescriptions because the likelihood of those reaching the black market and being sold is high if it's not in their urine. So we have resources for that to ensure that the patients are actually taking the medications and not selling them. Proper handling of narcotic meds, it's important to lock all prescriptions up. The paper prescriptions that are dispensed, if they are not given to the patient right away, we need to lock them. And then it's also proper handling of narcotic meds in the office, making sure that they are locked and that there's a sign out of when things are being used. Because believe it or not, some healthcare workers do abuse the narcotics in the facility. So it is very important for proper handling and storage of our narcotics.